Okay, so we're just getting started on the right knee here, and right out of the gate you can see there's some loose pieces of cartilage in the knee. So before we go any further, we're going to go ahead and put in our shaver, and then in a minute we'll get a grasper, see if we can't grab that and remove it. There's a couple of them that we've seen. So there's one. And it looks like that might even be stuck in the back or even part of the posterior horn of the meniscus. We'll look over here. Okay, and we'll show you some more in just a little bit, but this is clearly not normal. Now I'm concerned that that might actually be meniscal tissue. Okay, we'll show you some more in a minute. Okay, I just wanted to show you where we're at here. We're looking in the notch just right out of the gate to determine the ACL status because it was inconclusive on the MR. There's probably a reason for that. Here you can see these fibers. They're really connecting into the PCL. There's really nothing in this lateral wall. And so you have what we call an empty lateral wall sign, and that was confirmed when we examined your knee. We were very suspicious, but there's no ACL here. So we're going to have to reconstruct that ACL to give you a stable knee, and that's one of the things we were considering, hoping we didn't have to, but we are going to have to reconstruct the ACL. So I'm just going to take away the remnant of this old graft, or old ligament. And you can see there's really nothing there. And while they're getting things ready to go, we'll look around the rest of the knee here. Pause. Okay, so we're back on the medial compartment. This is a little tear in the meniscus here. We can see how this is split. And then when we get to the back of the knee, we're going to see what we find back here. We'll show you some more in a minute. Okay, so what this is the remnant of an old bucket handle tear that's mostly disappeared by now. We're looking in the notch. Let me back up and give you some orientation here. This is the notch. It initially looked like a loose piece, but what we're seeing is that this is actually what's left of the posterior base of a bucket handle tear. So we'll get that removed. There's no reason to leave that. It can only cause problems. Okay, so now that tear's been debrided, that little flap is gone, so that won't cause any more problems. I'm going to just polish it here and smooth it out. The root of the meniscus is not torn, so we don't need to repair anything there. Okay, so we're going to look up at the patellofemoral joint next. And as we look up at the top of the screen, we should see your patella in a minute. Here's the trochlea. And I'm going to put in the shaver in just a minute. Hold the leg for me so it's like that. Okay, watch this hand. I gotta get, yeah. Okay, recording. Okay, so as we look at the top of the screen here, that's the patella. We're just removing a little bit of the fat pad so we can see better. There's the patella. So that cartilage looks good. The trochlea, which is this groove, you can see this little valley right here. So this trochlear cartilage. Sometimes it's broken up and arthritic. Yours looks good. We can take away a little bit more of the fat pad and trace this trochlea all the way down the front of the knee, all the way down to here. And then when we bend the knee, you'll see that's where the ACL lives. See that little notch down there? So that looks good. I don't think there's anything else to do here. We're going to look in the lateral compartment next. Okay, so this is the lateral compartment. We've already done a limited partial meniscectomy. My concern is that there's still a split in the meniscus right here. And so we may use a special type of implant where we can put a loop all the way around the meniscus. It's called kind of a haybale stitch, just to hold that together and give it time to heal. Because I'm just concerned that that's going to become a tear, and we don't want you to lose, look at that, we don't want you to lose that meniscus. So we're going to decide what to do here in just a minute. Okay, so for now we've got this lateral meniscus repaired with one, what we call a haybale stitch, right at the popliteal hiatus. And I hope that does the trick for you. That looks like that's going to hold that down pretty well and give it a chance to heal. We're going to put some PRP there as well. Okay, so you can see we have some tunnels in the bone. Those blue and white sutures are basically running in the same direction that your new ACL graft is going to run in. Hold the camera here. So the next step for us is to go ahead and get the graft and pass it through the knee here. And you'll see that in just a minute. We're going to use those sutures that you see on the screen as leader sutures. Go ahead and pull. Oh, stop. Okay, pull. Okay, and so now those sutures are pulled through. And now we're going to separate them out and pull just one side. If you look on the screen, you'll see a button come up. It's called an endo button. There it is right there. Let me try and get you a better picture here. Okay, so we'll pull the button up. There it is right there. Okay, hold the camera. And then attached to that is your new ACL. And once we get that purple mark right level with the bone, then we know that we can flip the endo button. Pause. Okay, so there's the new graft in position. You can see our BioBrace augment on it. That looks great. This is a 9.5 millimeter hamstring graft now. I'm very happy with that. This will be the end of the video. Everything else is going to be outside the knee. Good luck to you now. Bye-bye.